Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I'm here with Incident Manager Dr. Stewart Kennedy. Dr. Kennedy, the hot topic out there is COVID-19 testing. So as everyone knows, the COVID-19 Assessment Center is part of our hospital operations right now. And there is an increased demand, in fact, a very high demand right now, which means sometimes people are waiting longer than they expect to have their test performed and then to receive results. Is that just happening here in Thunder Bay?
No, Tracie, this is a problem throughout Canada, if not throughout the world, in that the increased demand for testing is overwhelming what we can supply at the present time. And we have a lot of public health agencies, a lot of schools, a lot of employers making their own rules.
So what does that mean?
Well, employers need to follow all the public health guidelines and all the recommendations. They just can't say, you know, I think we should have a test before we go to travel to Northwestern Ontario because we want to make sure we're safe. I mean, we need to follow the rules. We also want you to be safe, but we need to follow the rules. Initially, when this all started, we really were emphasizing treatment of asymptomatic patients to make sure we look at spread in the community. But right now, we have one active case, I believe, in Northwestern Ontario, or certainly in Thunder Bay. So that's really not a large sort of representation of community spread. So we need to begin to prioritize, and certainly we are obligated to do asymptomatic patients and or asymptomatic people who are visiting long-term care homes, who may be traveling outside the region, who are healthcare workers. But those are the prioritization. We should not be doing testing right now as a priority basis to deal with what we call totally asymptomatic patients who do not need a COVID swab according to public health guidelines. So we need to respect what's happening. And we've been overwhelmed, and we only have one assessment center here in town. The great partners in the paramedic program, and they're sort of doing a lot of the elderly patients who can't get out of their house, and they're doing children under 12 because it takes a longer time to perform those testings. But we can do a better job. We were just handed this task by Ontario Health North several months ago. We need to staff up and make sure we have the proper resources. But we all have to do a better job. That includes Ontario Health North, that includes public health, that includes schools, that includes our government, and we need to do a better job as better coordination. I mean, where's primary care in this? Primary care, they should be the opportunity. Primary care wants to get involved, that they should have the opportunity to get involved and do testing in the primary care office. Pharmacy should be involved at a more sort of expedient fashion. We do it for flu shots, so why aren't we doing it sort of reaching out? So I think there's just not as good coordination as there could be, and we need to encourage the responsible parties to step up and provide us the resources and the personnel to enhance our testing, because testing is a very important tool with COVID-19.
Okay, so let's back up just a second. What do you think the reason is that we're becoming so overwhelmed? Where are all of the appointment requests coming from?
I think we may have been a bit complacent when we saw our numbers go down during the summertime. I don't think we expected the large demand from the public once the school started up. I think we're not we need to do a better, deeper dive into symptoms. I mean, people who have allergies and a runny nose, that's a symptom, and they're requesting to get tested. But there's also common sense to be applied here too. I mean, with a runny nose, a person who gets it every sort of fall time with allergies, do you need to be tested? So I'm challenging the system a little bit that we need to relook at how many people we're testing, because right now we want to make sure we test the appropriate people who have symptoms or who risk of exposure is going to expose a vulnerable population.
So right now, our assessment center is receiving about 300 calls a day. What is the impact of that? How long are people waiting for tests?
So right now, if you're, we prioritize. We get a call from the assessment center. That's why it takes a little bit longer. And the assessment center number, I'll repeat here, is a 935-8100. And our website for booking online is www.tbrhsc.net. So right now, for asymptomatic patients, the waiting time can be anywhere from 3 to 7 days in that ballpark, depending on the priority. But if you're a healthcare worker, if you're having symptoms, if you've had an exposure, if you're a high priority individual or case, we can actually get the result done within 24 hours. And we can get some results, return the results back in certainly within a day if it's high priority that may have affected a vulnerable population, or the turnaround time is going to be 2 to 3 days based on the public health lab in Toronto.
Okay, so if you're waiting 3 to 7 days to get your appointment for a test, then you're waiting additional time to receive your test results.
Correct.
Okay,
Yes. So
and that's up to, did you just say about 3 days, or is it more than that?
So right now it's a book online. We're trying to have 3 to 5 days, and then it's going to take another probably 3 days. So it can take up to a week to once you make the decision, get your swab completed, to getting the results back. And that is definitely too long because people have to stay home from work, take care of their children, they live their uncertainty. So that is too long. And as partners, not just Thunder Bay Regional Hospital, as partners, we got to do a better job.
Why are people prioritized? So why would one person get a same-day test and another person wait for 6 days before they can get their test?
Certainly exposures. So if you've had an exposure to a COVID-19 case, we want to prioritize that and get that done right away because we don't want that individual going out into the community. They will still have to do, if they're exposed, they still have to do their 14-day self-isolation, but we want to trace all the contacts so we get all those testing done. So we need to do a lot of better contact tracing. The vulnerable population, if we discharge an individual here from the hospital going to go to a long-term care facility, a retirement home, we want to make sure there's no spread into the vulnerable populations. Those are given priorities. I mean, sporting events, certainly important. Certainly schools, with children and parents, certainly important, but they're not the high priority we have at this point in time. They have to be done based on the public health rules, but we only have so much capacity at this point in time.
Okay, so you talked a little bit about what needs to be done to reduce those wait times. So our partners at EMS are doing some testing for people who can't leave their homes. We have some good news in terms of the assessment center relocating into the medical building, hopefully next week. Will that enhance capacity a little bit?
Yes, it'll be a space that is not a trailer for the what we have right now is the emergency department. It'll be a permanent space. It'll be right off the parking lot. It'll have a larger rooms. It'll have sort of more staff. So it will also certainly enhance the capacity. But it's certainly been a challenge running the assessment center since this started, finding capable staff, finding the trained staff, finding enough staff to run the assessment center has been difficult, not only here, but throughout Ontario and Canada.
So what would your final message be today for someone who is thinking about picking up the phone, calling to book an appointment, or getting online to book an appointment for a COVID-19 test today?
I think go to the public health website, follow their recommendations, making sure you need the test, and you're just not interested in a test, that you need the test because there's been some type of either an exposure, schools requesting it, sporting teams requesting it, some type of travel, you're visiting long-term care, you have patients or you have family in sort of a home that's had a vulnerable population. You want to make sure you take care of the population around you. So, and also be patient. We are going to improve on this. I'm quite confident we will improve as our system partners get together and look at different strategies. But again, this has been a learning curve throughout the world, and just sort of certainly encourage everybody to be patient as best you can, because we're doing our best, we can do better, and we will get it right.
Well, and particularly, the people on the other end of the phone, we have really dedicated staff who are working extremely hard. Unfortunately, not everyone calling is exercising patience with them. We ask for people's kindness as always.
You know, I understand the people's frustration, and we're frustrated too. You probably sort of sense my frustration today. I mean, but certainly we can't get angry. We just have to do a better job. And I understand the frustration because it affects their place of employment, it affects their job security, it affects their children, it affects getting back to life normally. But remember, we've just had sort of the last week or so in Ontario, over 300 cases each day. That is up from over 100 cases just in August. So this isn't going away, and we need to continue to do our sort of our diligence to make sure we're actually on top of things and doing all the public health recommendations, staying, you know, those 6 feet apart, washing your hands, wearing a mask. Those are so important, because now there's also some evidence coming out that this is airborne too, which enhances our risk of population. This is a very virulent virus. Good news at this point in time, most of the cases are 40 years of age or under, so it's not affecting our vulnerable population. But those 40 years of age and under, eventually they're going to come in contact with a more senior group. And that's why we need to keep on with those precautions. And that's why we do need to do a better job for the testing, which the staff here are doing an unbelievable, remarkable job with limited resources, working out of the trailer, taking all sorts of criticism from many people, which is not deserved. We need to support our staff better and be respectful of our staff, because they are doing an outstanding job at this assessment center with limited resources, which we are trying to fix.
Great. Okay, thank you so much. A reminder to folks that if you are looking to book, if you are asymptomatic, go to the website, www.tbrhse.net, to book an appointment. If you have symptoms, then call the number, which is 935-8100. Thank you so much.